Hi, my name is Nehar Rajapurkar and I have secured rank 4 in INICET 2022 and rank 5 in NEETPG 2022. I have done my MBBS and internship from Sethi Medical College and KM Hospital, Mumbai. To be honest about it, I am feeling on the top of the world about my result, but I want to confess that a part of the result is something that I had expected from the way I had prepared and the way I was scoring in my GTs, but at the end of the day, it's a delightful surprise. My personal journey in appearing for the PG entrance exam has been a roller coaster ride. In my first and second year, I mainly focused on academics. I was more into quizzing. So I did a lot of quizzing at the state, national and the international level, especially for subjects like microbiology and physiology. In my third minor year, I decided that I would go for residency in US. I gave the USMLE Step 1 exam. I got a good score, that is 268 in that. But after that, because of the COVID scenario, the uncertain geopolitical situation and the travel restrictions, I decided it won't be possible to go to the US for residency. Instead, I decided to stay in India. Of course, there were a lot of my friends saying that it won't be possible to do the NEETPG exam or the INICET exam in 6 months, and mostly I would be taking a drop. But with the help of the motivation and the support from my parents and my friends, which kept me performing on the optimum level, I was able to crack it. So I started my NEETPG preparation in October 2021. For that, I had joined the DAMS grant test, subject-wise test and the QBank course. Since I was not able to attend the live lectures during my MBBS years, I discussed the live lecture notes. I found the live lecture notes to be very concise notes on the given subjects, and they covered all the important topics which were frequently asked in the exams and the important points pertaining to them. So it helped me cover those 19 subjects in a short amount of time. And along with that, I was regular with my grant tests, and I solved I solved a lot of grant tests, and I went through the explanation of all the questions. During the final months before my exam, I joined the INICET test and discussion course. So the test and the discussion, questions and the topics discussed in those lectures, they helped me a lot. In my exam, and I could solve a lot of questions using them. And but the highlight of my journey with DAMS would be the DAMS visual treat. So the notes I had got from those 6 days of rigorous lectures, they were very helpful for my exam, and I can honestly say that in the few days before the test, I only referred to those notes as my main source of preparation. For my preparation, which I started in October 2021, I joined the DAMS QBanks and the test course. Along with that, I used to discuss the DAMS live lecture notes with my friends who had attended those in their during their MBBS. So I found those live lecture notes to be a very concise notes of the given subjects. So with the help of them, I was able to cover the 19 subjects in like a span of 3 months. Once I went through all the subjects, I joined the test and discussion course, which was targeting the INICET 2022 exam. So the topics and the questions discussed in the test and discussion course, they helped me a lot during my exam, and using the knowledge from them, I was able to solve a lot of questions. So about the DAMS study material, the top 2 courses which I liked about would be firstly the INICET test and discussion course. So for every lecture, they had a 8 hours discussion session in which an experienced faculty not only discussed the question, but they also discussed the topics related to that question. So in the 8 hours, the notes which you made pertaining to that particular subject were very concise, and they were especially targeted towards the INICET exam. And especially about the tests, the way which were said, they were a mix of one-liner questions, multiple answer correct questions, match the following questions, which is the pattern in the INICET exam. So it helped me develop the mindset for that. And secondly, the DAMS visual treat. Hands down, DAMS visual treat is the best rapid revision source for NEETPG and INICET INICET currently circulating. So in those 6 days, each and every subject the faculty tried to cover in 1 to 2 hours, and the notes we got for that particular subject were so concise that, for example, like even vast subjects like medicine, you could just cover them in like a span of 2-3 hours. So like just before the exam, and when we are stressed and we are like we want to cover this subject in a short span of time, we were able to do it because we did the DBT once. So the main source of information and the lectures whatever I saw was the eMedicoz app. So eMedicoz app, it always used to upload the lectures, and it used to tell me that that when a lecture is going to happen, or if some lecture is going to get shifted. So it helped me to arrange my schedule in that way. And also I used the bookmark aspect of the Q bank, where I whenever I had a doubt in a particular question, I bookmarked that question, and I could come back to that question at the end when I wanted to revise that particular subject. I found the eMedicoz app to be very accessible in order to see the lectures which were a part of the TND and the DVT which I saw. Every time whenever a lecture was getting uploaded or rescheduled, eMedicoz app used to tell me the same. And about the Q bank, the number one thing I like that they also added a bookmark option and I guessed it option. So whenever like there was a question which I wanted to come back again, I could bookmark it, so I could approach it again. So the faculty that influenced me the most in DAMS would be, first of all, Dr. Sethi. So the way he approached radiology was very unique. Whenever he used to look at a radiograph, he used to discuss it in an integrated manner so that all subjects are covered. And secondly, he is a great motivator. In between, during the lecture, he used to discuss some motivational quotes. So it was kind of a two-way session in which we were getting the information also and he was motivating us also. And secondly, Dr. Deepthi Bahel, hands down, she is the best educator in OBGYN for NEETPG. So whenever she discussed a particular topic, it was very thorough. So when, like for example, there was a topic like recurrent pregnancy loss, and she discussed it in such detail that you could solve any question based on that particular topic. And I honestly believe that whatever questions I could in OBGYN I could solve were all of them were from her notes. And last but not the least, Dr. Sachin Arora. So the way he approached theoretical subjects like ENT was by his method of equation, where he equated terms with each other. So I could also apply this approach to other subjects, so to kind of make them easier for me to digest. So my favorite subject since my MBBS days was medicine. In medicine, the approach of how to diagnose a patient, how to treat the patient, and how to follow up a patient has been my chief interest. So currently, I want to pursue MD medicine in a central institute. After that, since my undergraduate days, I was very interested in cancer treatment and cancer research. So I am thinking of going for super specialty in oncology. And for my message to juniors, it would be I would just give them 2 points. My first point would be, it's never too late to start anything if you are doing in life, whether it be your preparation for NEET PG or INICET. It's never too late to start. Start if you approach it in a systematic way. And secondly, whenever you are going for a particular thing in life, always go with it with the growth mindset. Whatever happens, if it goes in your direction or against your direction, always try to get a learning point from it so that you can grow. So to conclude, DAMS has been a very important part of my journey, and it is one of the main reasons that I have been able to achieve this much. And for my concluding quote, as Dr. William Osler said about clinical medicine, that if you only read the books without seeing the patient, is not going to see at all. While if you only see patients without reading books, it is like sailing an uncharted sea. The same thing can be applied to MCQs, which DAMS has really covered on that side as well. So I would like to thank DAMS for providing me with such a beautiful experience.